I've been very impressed by the level of detail that went into the planning and how quickly it was put together, and also the very tight project management of the scheme throughout the process.
By working closely together, the team were able to ensure that the project was delivered on time and within budget.
We will certainly be looking to use this modern method of construction moving forward on other healthcare facilities. It's been a great success here for both construction partners, designers and clients.
We've been in this industry for 60 years plus, delivering quality buildings in the healthcare, education, custodial, commercial, construction and various sectors. We have manufacturing facilities in Brandsburton. They're fairly extensive. We have 4 manufacturing factories. We employ continuous improvement techniques and subscribe to lean manufacturing and Kaizen. The materials we use we try and keep it pretty standard, but that doesn't mean that we limit the application in any way whatsoever. The benefits of off-site construction are obviously speed, number one, health and safety, because our product leaves this factory 75 to 90% complete. The minimal disruption to site traffic. There's flexibility of product, flexibility of delivery, and there's obviously, in terms of client applications on sites that are very restrictive, the product works very well because we actually in and out pretty quickly and we can work to very restrictive deadlines.
It was vitally important for NHS Norfolk that in terms of our key commissioning priorities, we make improvements to stroke services, and stroke rehab beds are a key part of that implementation. The time frame was very tight, and it's just under a year since we hit the go button and we're at a point of opening the unit. We're still at the point of finalising numbers, but I'm being assured that it's bang on budget.
By using this method of construction and project procurement, we have saved between 6 and 10 months on the build time. Early in 2009, we brought together not only the architect and the main contractor, but also professionals from the NHS locally. This was a mixture of nurses, physiotherapists, and all the other people that would occupy the building once constructed. We worked with them to develop the plans, incorporating, where possible, all of their requirements. Norwich Community Hospital is a busy site. The position for the new buildings was adjacent to an existing car park, and by using off-site modular construction, we were able to limit the amount of traffic movements on site during the construction phase. The building is approximately 2,600 square metres. It consists of 2 identical floors, which each contain 24 beds. On the ground floor, we have stroke rehabilitation services, and on the first floor, we have general rehabilitation services. There is a smaller second floor in which we have some therapy space, gymnasium, therapy kitchens, etc., plus all of the plant for the building. Key to the success of this project was building a team that we could work with. We have worked extensively with Mansell's in the past, as well as the rest of the project team.
In terms of the off-site construction used for the facility, the safety aspects of not working on-site in all weathers certainly enhanced our safety performance. There's no reportable accidents across the scheme, which is great news. This was all factory produced in a clean, dry environment. We had particular challenges around the car park, and the main hospital was a live facility, so we had to take care with patients coming in, sharing the main car park with us, and we had to put some significant traffic management into place, reconfiguring the car park so we could work alongside the current hospital users. So that was a real challenge, but one we overcome quite well with working with the hospital team. The building's been delivered to a high standard of quality, enhanced really by the factory manufacturing process. It was constructed within a dry environment to British standards and real terms of cost certainty, it was very clear from the outset with the budget set that there was no flexibility in that, so we needed to be sure that this system was appropriate and the budget was met. Working with the modular company, we managed to get a guaranteed maximum price very early on in the procurement stage, and it was a matter of managing that process right through to the end, and we've come in on budget